Good day. ASOKA Services welcomes you to this session. We will continue to translate the adherence guidelines to data. In the last two or three videos, we discussed about the differentiated model of care, DMOC. We looked at the two different types, which is the RPCs, repeat prescription correction strategy, as well as the switching of patients from the first regimen, from any other regimen to the new regimen of ARVs. Currently on this video, we will only look on the RPCs. We discussed in depth that the facility pickup point was previously called the SFLA. And in each facility, there can only be one facility pickup point. Even if we have more than 30 patients picking up in the pickup point, it's only one facility, one pickup point. The adherence club can only happen if it is a group of patients picking up together at a specific time in a specific venue. They will meet together for about 30 to just a bit over an hour, and they will discuss different topics. And after those discussions, they will then collect their medication. If they meet together as a group and do all of those activities, then it is an adherence club. But if they are coming on a one-to-one basis without any discussion, then it is not an adherence club. We also explained what is an external pickup point. The external pickup point basically it's all the pickup points that are happening or that are available for patients to pick up medication outside the facility. In these pickup points, there is no involvement of any personnel from the facility. There is no staff member from the clinic that will go and give medication to the patients. Also, the facility was never involved in sourcing these pickup points. It is mainly done by the National Department of Health or any other people or partners that are outside the facility environment. One of the biggest things also with the external pickup point is that they will be available to service more than one facility. They are not linked to a facility. And they can also service patients from another district in another district. It's up to a patient where they want to pick up. That is the external pickup points. For any of in detailed explanations in these modalities, please refer to the previous videos. I will put a link on the description box below. We also discussed that these new or these rearranged modalities now, they differ mainly with where their medication is packed, but that's not what determines the naming of the pickup point. The external pickup point is the only one that is being packed only by CCMDD. The facility pickup point and the adherence pickup point can have parcels packed by the facility itself, by the CTU, or the CCMDD. So in other words, it does not mean that the external pickup point is a true representation of the CCMDD patients that are packed by CCMDD, unless the facility only has external pickup points. Also, look on the previous video, watch the previous videos for more detailed explanation. In this video, we will only be discussing how do we measure then the implementation of these policies in the facility level. The source documents for this will be your clinical notes, where the clinicians will write. We'll also have your registers, which are your monitoring tools, and we also have electronic registers, your TIA.net and SyNCH, that help us to measure the implementation of these policies. In the clinical notes, the clinician needs to write that the patient is enrolled or even now deregistered in any of the DMOCs, and it needs to state clearly which option in the DMOCs did the patient choose, the facility pickup point, the adherence, or the external pickup point. It will be great if in the adherence club, the clinician name the adherence club that the patient is going to pick up in, because then it will make capturing on TIA even easier. The external pickup point name would also be great, because then it will make easy for follow-up, for referencing for any other clinical care that this clinician might not be available for, but another clinician will be taking over. In these clinical notes, we also need to know any investigations that were done in the barcodes so that we capture and we can also make a follow-up. The validity of the prescription. Remember now, we can script for 6 or even 12 months. The validity of the script, remember, does not say that the patient is getting all those medication immediately, but it says that the patient can collect medication for this script for 6 months or for 12 months. The clinician also needs to state the next pickup point for the patient, as well as when is the patient going to come back for a clinical visit to the facility. All of this will be captured on the clinical note for ARVs, on the one that you see for HIV positive patients, and on the chronic medication clinical notes for any other chronic disease. The monitoring tool is what we use to call the Adherence Club Register. Previously, from 2016 up until now, March 2020, this register, we used to use it for space and fast lane, as well as your Adherence Club, but mainly for any patients that had their medication packed by CDU and facility. And we also used it for CCMDD patients that were not your ARV or your HIV positive patients. We would then use this register. Now, with the new guideline, we still need to have a record for any patients that are not packed by CCMDD. Remember now, the CCMDD has a list of patients with every parcel that they bring. So we know which patients are going to pick up from this parcel from CCMDD. But for facility pickup, for facility packed medicines and your CDU packed medicine, we will not have a list of patients unless we use a register. This register can also state the pickup schedule. Is it a 2 months or a 3 months? But we will look into that when we discuss more about the Adherence Club Register. This is the cover page for the club register, and those will be the front page. We will discuss more on the register itself in the following videos. Now, UTIA.net is an electronic register that captures also from the clinical notes as well as from the RPC monitoring tool, which is the Adherence Lab Register. When we decant a patient, or when we, take the patient out for repeat, for RPCs for the first time, or even on the clinical visits, the data capturer needs the clinical notes to capture the patient and allocate the patient in line with what the clinician has allocated the patient to. So we need the full information from the clinical notes to be able to allocate the patient in the correct DMOC. With the follow-up visits, especially for your adherence lab, we then need the adherence register to capture the visits and also give an outcome. Remember now, SyNCH is there as part of the monitoring tool for any of the CCMDD packed patients. And as for the patient list that come with the SyNCH pack, with the CCMDD packed medication, it also helps us as part of the monitoring tool. On TIE, when we register the patient for the first time on any of these DMOCs, this will be the screen, hence we need all the information from the clinician. For the data capturer to be able to capture and allocate the patient in the correct DMOC, external pickup point or facility or adherence club, it needs to show on the clinical notes. For them to be able to allocate the months of prescription, the number, 6 months script or 12 months script, it needs to show on the script, as well as to capture the next clinical appointment at facility or in the adherence club. For the adherence club, it will be the next pickup point. You will take note now that for external pickup point and for facility pickup point, there's no option there to click. The option for the next visit is for the facility and for the adherence. But we will discuss what this means more when we discuss more on club or DMOCs capturing and monitoring on TIE. Then for adherence lab, we also have this screen that we use on TIE that gives us the outcome or monitors that the patient did pick up or not. There is also, when you run the lists on TIE, In this case, we ran the appointment list. Remember, this is from our training data. It would tell you if there's any patients that are part of the DMOCs and what tests are due and when they are visiting. This list can also be used to monitor or manage patients in all of these DMOCs. SyNCH is the electronic register that is used for all patients that are pegged by CCMDD. I'm not saying external pickup point for all patients. Remember now we said CCMDD can peg for facility pickup points, for adherence club, and for external pickup points. So for everyone that has been pegged by CCMDD, you will also get the information on SyNCH depending on the facility using the system correctly. So if SyNCH is used correctly in all facilities, we will be able to see our patients that are collecting from any of the CCMDD related pickup points. The clinician also use SyNCH for submission of script to CCMDD, and SyNCH also assists in generating the dates, and they will also choose the venue where the patient will pick up, and it also monitors for us if the patient did go and pick up in the external pickup points or not. This would be the landing screen for SyNCH. We will also discuss SyNCH separately in relation to the DMOCs. And this is the screen that the clinician use to register the patient. The patient gives consent, the details, as well as the collecting point and the prescription details. Basically, they send the script on this. And we can then be able to monitor and see if the patient is still picking up correctly. So the measuring of the adherence guideline implementation starts with the clinician when they complete the clinical notes, and the clinical notes have all the information that is needed. The monitoring tool, in this case, the adherence lab register, also gives indication and assists us to update all tier or even, our needs data elements so that we can measure the implementation of this policy. SyNCH assists us in measuring or allocating on submitting scripts to the CCMDD, and tier we use then to capture all the patients that are on DMOCs, and we monitor the implementation using all of these sources. In the next video, I will discuss in depth the adherence club. Goodbye for now.